Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. At the Hauser Neck Center, I and my team are seeing more and more people with blurry vision. And when you talk to some of the patients, it's clear that the main problem that they have is actually gaze instability. If you're somebody who you really have a difficult time, say, driving in a car or being in a car, and it's like the vision gets worse and worse and worse with motion, because you don't realize when you're in a car, the car's kind of doing this. So most of us take for granted that we can move our head and our vision's going to be fine. But think about all the different things that have to happen coordinated between your neck, your brain, your eyes. So gaze instability means that the visual field is not stable. So gaze stability is a football player, rugby player, somebody who's moving, who's exercising. No matter how you move it, the gaze is very, very stable. Like, you don't get blurry vision. You don't get in this position and then all of a sudden everything's all blurry, or things are just moving and you're not even moving. So if you you feel like you're moving or the visual field's moving, you likely have some form of gaze instability. Now, normally if somebody has blurry vision, of course, the first thing to do is to go to an ophthalmologist, and I'm completely supportive of that. I would prefer it that patients do get have a retinal specialist take a bunch of pictures, get a thorough evaluation, and often when they come to Caring Medical, they'll say they just didn't find anything. Like, in other words, the structure of the eye is fine, but then what's causing the gaze instability? Now, some of the people then will go to a balance center. There's all different kinds of balance centers, because they can give exercises and different things that normally can improve it somewhat. But again, what's the etiology? And often people aren't thinking, well, maybe there's a neck component to the gaze instability or the blurry vision. So we do a bunch of tests, which I'll talk about, and I'm going to explain just in a very short time period, how ligamentous cervical instability can cause blurry vision or gaze instability. Now, there's all different kinds of blurry vision. So these are some of the names, and all of these things potentially could be from a neck problem, and the neck problem specifically blocking the jugular vein, which has a lot of detrimental effects on the eye and can give all kinds of visual distortions. That's basically what they're called. The vision is distorted. So light comes into the eye. It's how much light enters the eye is from the pupil. Then eventually it hits the rods and cones in the retina, and then it's transmitted electrically through the optic nerve to eventually get to the visual cortex in the occipital lobes of the brain. So you actually don't see till your brain sees. So any disruption of the transmission of what you're seeing anywhere in here is going to distort the vision. So that's kind of a key component. So thus, if somebody has blocked jugular veins and it's increasing the pressure on the brain, that could affect vision because it affects the optic nerve, it affects the lateral geniculate nucleus, and it can affect the occipital lobes. Now, these are the muscles that move the eye, and any sort of nerve problem to these muscles will cause the eye to distort. Like, in other words, one eye might look in and another eye looks straight. That's a sign that there's a cranial neuralgia, and cranial neuralgias can be from a neck problem. one of the main nerves that innervates the muscles of the eye is the oculomotor nerve, and this explains the neurology of it. And any sort of ocular motor neuralgia or palsy, if the etiology is unknown, according to Hauser's law number 2, so you'll hear me on these videos talk about that a lot. So Hauser's law number 2 is that if a person has a symptom, a chronic symptom, that is elusive, like the cause of it is not known, like they've went to various healthcare providers, doctors, and it's not known, if you follow the neurology will lead to ligamentous cervical instability. The nerves that innervate the muscles to the eye, they originate in the brain stem. So the brain stem is just above the upper cervical region. So any sort of ligamentous cervical instability in the upper cervical region can block the cerebral spinal fluid, can block the jugular veins, can increase the fluid onto the brain stem, and could cause a problem in the nerve transmission of cranial nerve 3, cranial nerve 4, cranial nerve 6. So this just shows them oculomotor nerve is cranial nerve 3, abducens nerve is cranial nerve 6, and trochlear motor nerve is cranial nerve 4. And those are what innervate the muscles of the eye. This is just another look at it, and it shows the muscles, the various eye muscles that it goes to. So obviously, if you have a weak eye muscle, right? So this eye might turn in, might turn out, and this one's straight. You could see where that could cause gaze instability, right? Because it's not coordinated. So this is one of the figures that I made that shows that ligamentous cervical instability can cause a compression or narrowing of the internal jugular vein. Then the fluid can't get out of the brain, and we have to remember that the eye is in the brain. So anything that affects the brain could affect the eye. Well, then the veins, the episcleral veins that drain the eye, those can't drain either because, again, if all the fluid's primarily going out the jugular veins, so if it's blocked here, there's going to be increased pressure of all the veins proximal to that, including the veins that drain the eye. Well, if the eye can't drain, what's going to happen to the eye itself? What's going to happen to the optic nerve? And basically, if the eye can't drain, then what? Toxins, proteins, inflammatory substances, tau protein, amyloid starts accumulating in the eye, which of course can give blurry vision, and ultimately you're going to get high eye pressure. So if you have high eye pressure and you don't know the cause of it, and you're normal weight, you don't have diabetes, but you have symptoms suggestive of a neck problem like clicking, popping, grinding, you have some dizziness, you have blurry vision, you really should get your neck checked out. And the way that we document ligamentous cervical instability is by digital motion x-ray, where we take basically a movie camera picture of the vertebrae and we have the person move. And what we normally find in people who have gaze instability, blurry vision, we find that the vertebrae are moving excessively. And when vertebrae move excessively, especially in the neck, the upper neck, it starts encroaching on very important structures such as the spinal cord, the vagus nerve, the jugular vein, the superior cervical sympathetic ganglion, and that's related to pupil dilation. So this basically is a detailed pictorial, but basically crap's going to accumulate in the brain and the eye if you can't get the crap out, right? If your toilet's obstructed, right, what accumulates in the toilet? It's not pleasant. So that's the same thing that can happen to your eye or your brain. And these are some of the consequences of a cranial nerve palsy, or when the nerve supply to the various eye muscles is not there. So especially if you have a child and the eyes aren't tracking, some of these things could be going on in your child, especially if your child is addicted to the cell phone, electronic gizmos, gaming, and you're noticing like one eye isn't tracking the same. When I look to the left, when I look to the right, the eye should track the same. If one eye can't go all the way to the right or another eye can't go to the left or up or down, you probably have the start of a cranial nerve palsy and really should get the neck checked out. Yeah, and again, this just shows it. It's in the middle. See how this eye is inward and over there that eye is outward. These are signs that the nerve supply to a muscle that moves the eye is not there. And again, Hauser's law number 2, you got to follow the neurology, and the neurology of this leads to ligamentous cervical instability. So this is again a pictorial hypotropia, hypertropia. Like see how the eye is high, the eye is low, the eye is inward, the eye is outward. So ligamentous cervical instability can affect the eye many, many different ways. It can cause the ophthalmic artery to spasm. That's what I believe occurs when somebody has amaurosis fugax, where they basically can intermittently, and this occurs commonly with migraines, where you lose vision in one eye, and that's because the sympathetic system is too active. So that's the mechanisms of that. And that, like I said, it's common with migraines. If you have blurry vision and you have migraine headaches, I'm telling you, it's likely that you have a neck problem, especially if you have cracking, clicking, popping in the neck and you have neck pain. Now, the superior cervical sympathetic ganglion, that's the nerve tract that dilates the pupils. So especially if you notice that, man, I got light sensitivity. Like if all of a sudden you're noticing the bright lights hurt you or you can't go out in the sunlight, it's likely that you have some ligamentous cervical instability and there's too much activity here, so your pupils are dilated. One of the tests that we do in the office here is called a pupillometer, so we can document this, and then as the person's getting treated, we can see that the pupils are now reacting more normally to light. And then the big one, though, is internal jugular vein compression increases the cranial pressure or the brain pressure, and that ultimately will lead to increased eye pressure, and it can decrease the retinal supply. It can cause cerebral spinal fluid to accumulate around the eye nerve. We document this by measuring the optic nerve sheath diameter, and that can give all kinds of visual symptoms, including gaze instability. This is just a pictorial of somebody, any of us, if we have bad posture using the computer, using the cell phone, you'll get ligament injury in the neck. Eventually the vertebrae go forward. It causes compression of the various structures in front of the neck. The significant structures in front of the neck is the jugular veins. Those are the main drainage ports to the brain. The ganglion, where the nerve cell bodies, the DNA of the vagus nerve are located. The superior cervical sympathetic ganglion, which dilates the pupils and is very important to the eye. If you think about it, that's what determines how much light goes into the eye. The ganglion of that sits right at C2, C3. So any type of ligament damage, and let's be honest, man, if you're like this for 5 hours or you're in front of a computer for 8 hours, 9 hours at your job, like obviously we don't have humongous muscles in our neck. So what's keeping our neck vertebrae in proper alignment are those really small ligaments, which are called the capsular ligaments. If you really like this topic, I'd encourage you to read the article that Danielle and I wrote on capsular ligament injury. We wrote it in 2014. It's a very, very good article on the capsular ligaments, basically showing that if you have extended periods where the neck's flexed, and this can even be right with sleeping, right? People have pillows. Isn't everybody mostly sleeping like this? So even sleeping, you could potentially be stretching the capsular ligaments, looking down at a cell phone. So right now, if you're watching me and you're looking down at your cell phone, man, get your cell phone up. Or if you have bad posture in front of your computer, man, get your computer up. Because we need to have a normal neck structure, a normal lordotic cervical curve, that puts the ligaments in a restful position, in a shortened position. But prolonged flexion, it's just going to stretch out all those ligaments. It's ultimately going to cause encroachment of structures here which are detrimental to the eye. So normal ligaments, you injure the ligaments, the atlas goes forward, and when we do jugular vein studies, we find that most of the jugular vein compression is at the atlas or C1, and this is the process that causes it. And then when you get ligament damage, basically the suboccipital muscles, these very small muscles at the top of the spine here, right where the head hits the cervical vertebrae, those get really, really tense. So that's another sign if you're somebody who, it doesn't matter what you do right here, there's always a tension here. Well, you probably have upper cervical ligamentous instability. And that encroaches on the jugular vein. You get high brain pressure. The high brain pressure could ultimately cause a posterior eye squish, which I'll show you in subsequent figures, and that basically, again, affects the eye in a negative way. So ligamentous upper cervical instability with resultant eye pathology. So basically, a person can have ligament injury of the neck, basically encroaching on the jugular vein, then the fluids in the brain can't get out as well. They say that 70% of the fluid inside the brain is in the venous system. So again, like a clogged toilet, if the fluid, the 70% can't get out here, fluid's going to accumulate in the brain. So when fluid accumulates in the brain, of course, the brain pressure is going to go up. Then ultimately, you're going to get cerebral spinal fluid around the eye nerve. So imagine if the person has right jugular vein compression, it's worse than the left side. So what's going to happen is more fluid's going to accumulate around the right optic nerve than the left optic nerve, and this is easily documented by measuring optic nerve sheath diameter, and I'll show you some pictures of that. So it means that if you have more fluid around your right eye nerve than your left eye nerve, then it's likely the transmission of whatever you're seeing is going to go slower to the right occipital lobe than the left occipital lobe. So you can see where your body's like, what the heck, like the image isn't clear, right? So then all of a sudden you're going to get gaze instability. So we document that in the office, and when we unblock or help the person unblock the right jugular vein by correcting the neck curve and stabilizing the neck and showing them what positions they need to have the computer, the cell phone, sleeping position, then as this goes down, like as their optic nerve sheath has the normal amount of fluid, then transmission of the image is more normal, then of course the vision gets better. And then there's other ways that the ligamentous cervical instability affects the eye. One of them is you can get an excessive amount of superior cervical sympathetic ganglion activity, like I talked about, where the pupils are dilated. Now the problem with always having a chronically dilated pupil is that affects the fluid flow out of the eye. So imagine if you have jugular vein compression causing a block in the episcleral veins that drain the eye, so the eye can't drain that way. Then you have a chronically dilated pupil, right? There's another mechanism by which the eye can't drain, so what's going to happen? Well, stuff's going to accumulate in the eye, which I just call a polluted eye ecosystem. And then basically toxins and different things accumulate in the eye. So what can happen to the eye? Well, macular degeneration, retinopathy, cataracts, all these things can possibly be from ligamentous cervical instability leading to eye pathology. And some of these things you can see on MRIs. Like if you look at very carefully MRIs, so if you look at this MRI, you can see that there is fluid accumulation or enhancement of the cerebral spinal fluid right at the optic nerve head. And that's where we find much of the pathology that causes a loss of vision. So when we talk about high eye pressure, which is called ocular hypertension, leading to glaucoma, glaucoma is just when the optic nerve head is affected. So you can start to see that there's something going on in the optic nerve head by the fluid accumulation. And the question is, why is fluid accumulating there? I would say, well, it's because the eye can't drain properly because the jugular veins are compressed. And then when the fluid, the cerebral spinal fluid accumulates, you then get flattening. See how, for the most part, the eye is pretty circular. You can see we're on this, the posterior end here, and the posterior end here, you have bilateral globe flattening. So obviously, if the eye is getting squished from the outside, so that's called, I just call that the posterior eye squish. That can't be good for the eye because the eye is under pressure all the time. And then if you have toxins accumulating inside the eye, then the eye is going to get squished from the inside. So I call it the double squish. So right here on the outside of the outside layer of the eye is the retina. So the retina is caught between the pressure and toxins accumulating inside the eye, pushing from the inside. Then you have the cerebral spinal fluid pushing from the outside. So the retina is just getting squished, from both sides, the double eye squish, which I believe is from, in some patients, ligamentous cervical instability. I want to comment too, the patient population often that comes to Caring Medical is not diabetics. So in other words, when people come here, normally they have like normal weight, they're not excessively overweight, they don't have diabetes. So just know I'm probably seeing a somewhat different population than, say, a retinal specialist would. I'm in no way insinuating that all retinopathy, macular degeneration, cataracts is from these mechanisms. But if you eat reasonably healthy, you're reasonable weight, you don't have diabetes, and nobody can figure out why you have blurry vision or you have things going on in your eye, dry eyes, you're getting a cataract, you have blurry vision, the visual field is distorted, it's moving, and nobody can figure out the cause. It's likely these mechanisms from a neck problem, especially if you have neck pain and you have a cracking, clicking, popping in your neck, or the symptoms started after you had a car accident, you had a fall, you had a sports injury, you had a chiropractic manipulation that was rotatory, and then right away your symptoms started. This explains how high brain pressure, intracranial hypertension, can lead to eye problems. It can affect the cranial nerves, and we have data where over 90% of patients with visual distortions have extra fluid around the eye nerve, the optic nerve. And then this is just a quote, excessive smartphone use might influence development of all kinds of eye problems in children. So especially if you have a child, and I've said on other videos that the youngest person we've had come here who had horrible visual problems. They said the visual problems started, the visual snow and other eye problems started in kindergarten. So these can start at a very young age. So this is Karina doing an optic nerve sheath diameter. This is what the eye nerve looks like normally under ocular ultrasound, and this is somebody who it's twice the size. So this person has 5 more millimeters of cerebral spinal fluid around their eye nerve compared to this patient. And again, we do a pupillometer, so we shine light. It's a computerized system where we shine light, and in almost every patient that has visual problems, gaze instability, their pupils are dilated excessively, and when we shine light in that the pupil constricts more than the upper end of normal, which is 30%. So it just means that basically the person has ocular dysautonomia or a problem with their autonomic nervous system of the eye, which we believe is from the neck. These are some exercises. I'm not going to talk a lot on these, but if you have gaze instability, this would be some of the things that a person would do to get better. Now, ultimately, you have to correct the neck problem. So the way you correct the neck problem, if there's a breakdown of the neck curve called cervical destruction, you would do corrective exercises for that, which we give people, and then we determine what's the best way for them to open up their jugular veins by computer height, the way that they sleep, and what exactly is causing the jugular veins to get compressed, which often is ligamentous cervical instability, which we treat with prolotherapy. This is really, really interesting. Like, I've recently gotten interested in this topic. It's like, you know, we all know that Alzheimer's disease, you know, there's too much toxins in the brain, right? Like tau protein and amyloid and different inflammatory toxic substances. So the notion is, well, those must be the things that are causing the damage to the brain. But again, like a plugged toilet, I think the solution is actually quite simple, which is that the toilet can't flush. The brain can't get rid of the waste products. Why can't the brain get rid of the waste products? Well, if the toilet's clogged, meaning that the main drainage pipes for the brain are the internal jugular veins, then you have to open up the internal jugular veins. And what they found is the exact same substances that accumulate in the brain that cause Alzheimer's accumulate in the eye. And they even accumulate sooner or in greater quantities in the eye. Like, that's like fascinating. So is the eye condition and a brain condition separate issues or the same issues? Because let's be honest, like, if the things accumulate the same, in other words, it's the same substances, it's likely the same problem. By Occam's razor, the simplest solution is normally the correct one. So if tau protein and beta amyloid both accumulate in the eye and the brain, and the eye maybe does it sooner and in greater quantities, it's likely it's the same process. So what process could it be? Is it bad eating? Is it diabetes? Is it high blood pressure? Right? All those things could be it. But if somebody doesn't have high blood pressure, they're normal weight, they eat reasonable, you know, it has to be something else. So it's likely it's the drainage port to the brain, which is the internal jugular veins, is blocked. That blocks the episcleral veins that drain the eye. Then, of course, you get a polluted eye ecosystem as well as a polluted brain ecosystem. So, yeah, you could use medications or this or that, which may help somewhat, but is it really going to solve the problem, right? Like, for instance, say I got a toilet that's clogged, right? And it looks awful. There's just crap all over there, right? So this has to get plunged. So the way you plunge it is you got to get prolotherapy, you got to do curve correction to get the atlas back off of the internal jugular vein, then the toxins can get out, right? That's going to be the best solution. This just kind of shows there's sophisticated methods that you can use to document gaze instability, but the simple approach is just that the more a person moves their neck, right, they get worse vision. When you have gaze instability, normally the activities that move the head the most, they give the worst symptoms. So that's gaze instability. So some of the patients will say, I'm just telling you, when I lay down, I just feel way better. Like the stuff's not moving, my vision's better. That's again a sign that it's a neck problem. It's a neck problem. And this is just something that we made in the office here, the polluted eye ecosystem. Again, when you get blocked jugular vein, basically the eye gets all polluted, substances accumulate in the eye. And obviously, if the eye can't drain, you're probably in agreement with me, it could cause any kind of eye symptom. Like I said, or eye disease, macular problems, optic nerve head problems, optic neuritis, which is often seen with like multiple sclerosis. And I'm not saying all multiple sclerosis is from ligamentous cervical instability, but if I got diagnosed with multiple sclerosis, I would look into this, right? Like, why is the spinal cord getting damaged or the brain getting damaged with demyelinating lesions, right? The most logical explanation is those areas of the spinal cord have increased pressure, right? Any sort of structure, you could take your skin and just put a little bit of pressure here, right? It's not hurting me, but if this went on for a year, 2 years, you bet I'm going to get an ulcer there. I'm going to get an ulcer there. So the eye, too, can't handle pressure and too much pressure and pressure and pressure. So basically, 80% of the volume of the eye is the vitreous humor. That's the gel-like substance here. So you start getting inflammatory substances there, right, inside the vitreous humor. That's going to put pressure on the sclera, on the retina. You're going to start getting loss of retinal cells. That, of course, could lead to loss of vision. Like, all this is not just to improve the symptoms of the person so they see better. You're trying to stop the degenerative process of the eye, right? Just because somebody's getting older, that shouldn't mean that you're going to lose your vision, that every single person's going to get cataracts, you're going to start losing your vision, you're going to get blurry vision, your eye vision's going to get worse, right? So we need to preserve our eyes, and the way we do that is by making sure that the eye is healthy. So how do you get the eye healthy? Well, the eye, like other structures, it's continually producing waste products, right? The eye is just cells, right? Retinal cells, vitreous humor cells, like it's just a bunch of cells. So those cells make waste products, so you got to get rid of the waste products. I should say the vitreous humor, it's not cells, it's a gel-like substance that's produced. But again, you can get pressure, you get increased brain pressure, it pushes on the back of the eye, and if substances are accumulating here, that's going to push here, and that's where your retina is, and that can give blurry vision. So some of the clues that the eye problem is from the neck is clicking, popping, grinding in the neck, neck pain. If you have gaze instability or you're losing your vision and you have other signs or symptoms that occur with ligament problems in the neck, such as dizziness, digestive problems, your memory, right? You're getting brain fog, or you're having cognitive decline, constipation, swallowing difficulties, tinnitus, ringing of the ears, hearing impairment. Like, it's amazing how hearing impairment and eye impairment can go together. If you're having extreme reactions to stress, which can be a sign of a vagus nerve issue, you're getting tachycardia. All these things point to the neck. If gaze instability or blurry vision is from the neck, the treatment should be directed at the neck. It should be directed at the 3 structural things that occur in the neck: misalignments, cervical destructure, or a broken neck curve, or ligament damage. The ligament damage is treated by prolotherapy, which is an injection technique that causes the tightening, thickening of the ligaments. And at the Hauser Neck Center, what we do is typically every 3 months, 4 months, we'll retest somebody with the tests that I've talked about to make sure that the pathophysiology leading to the blurry vision or gaze instability is getting corrected. So we would repeat the eye pressures, the pupillometer, the optic nerve sheath, and of course do structural analysis to make sure that the neck structural problems are getting corrected, and with it that the jugular veins are opening, to give long-lasting help for those with blurry vision and gaze instability.